Trump administration has imposed new tariffs on branded drugs and pharmaceutical companies that have not struck deals with the president yet to lower US drug prices. It was a long-awaited move. Now, which drug makers will be affected and what does it mean for India? In this episode of Decodes, let's understand the latest US drug tariffs and what they mean for India. First up, what's the big news? The US has announced up to 100% tariffs on imported, patented and branded drugs. But here's the catch. Not every company will be affected. This is part of a bigger strategy to bring drug manufacturing back to the US, force companies to lower drug prices and also reduce dependence on countries like India. How does this policy actually work? Think of it as a carrot and stick model. The stick, 100% tariff on patented drugs and active ingredients. This applies to companies that don't lower US drug prices and don't shift manufacturing base to the US. The transition rule is that companies planning to move production to the US will right now pay 20% tariff, but they could face 100% tariffs in 4 years if they don't complete the shift. The deadline to build US factories is January 2029. And now about the carrot, that is, the ways to avoid tariffs. Companies are exempt if they build factories in the US, sign pricing deals with the US government, and are already negotiating with US health authorities. In fact, 13 companies have already signed deals and more such talks are underway. What's important to note here is, not everything is taxed. Generics, which are 90% of US subscriptions, attract no tariff for now. Biosimilars and genetic products, they are also exempt with a review due in 1 year. Some rare disease drugs and animal healthcare products, they are also exempt from this tariff. And this is crucial for India. More on that in just a bit. Now, not all countries are treated equally. Some countries have struck larger trade deals with the US. They'll face different pharmaceutical levies, with a 15% rate in the European Union, Japan, South Korea and Switzerland. The UK will face a 10% tariff, in part because the government has raised the price of what it will pay for pharmaceuticals. India, meanwhile, can face a full 100% if no agreements are made. Now, speaking of the impact on India, there are a few drug makers that focus on branded, patented and specialty medicines. These companies depend on high-margin US sales, which means they are more exposed to these tariffs. In fact, analysts believe that some of the larger players in this segment could see a big impact. However, most Indian drug makers focus on generic medicines that are relatively safe for now. 2 players have US manufacturing facilities as well, while another is an API supplier. Now, all of these companies are safe because generics are exempt. US factories bypass tariffs and raw materials are also still in demand. Now, what does this mean for you? Even though this is a US policy, it has ripple effects in India. Some of the possible scenarios that could play out in the short term are, if companies can't sell expensive drugs in the US, they may redirect supply to India. This could mean more availability and lower prices for some medicines. Mind it, it's only a plausible scenario. Companies haven't made any such announcements as of now. Meanwhile, pharma stocks react very fast to such global policy changes. This week itself, reports of additional tariffs led to sudden dips in Nifty Pharma. There's also a hidden risk that generics may not stay safe forever. Right now, generics are exempt, but the US has clearly stated this will be reviewed in the future. So even India's strongest advantage could face pressure. So the big takeaway is, right now, India still supplies the majority of affordable medicines globally. As long as the world needs low-cost healthcare, India remains the pharmacy of the world. But the pressure to move manufacturing to the US, that is real, and the rules, like we have seen in the past year, can change anytime. That's about the latest on pharma tariffs. WION decodes complex issues in simple language. What do you want us to decode next? Let me know in the comments below.